Hello, my name is Nicola Fraser, and today I will be conducting a training for new nurses on the importance of nursing sensitive quality indicators. According to Merkley et al. 2018, the NDNQI database includes nursing sensitive indicators and a report back function to participating organizations to use to evaluate nursing care and performance improvement. The NDNQI was established in 1998 by the American Nurses Association in response to America's Nursing Association's Safety and Quality Initiative. The NDNQI is a voluntary national nursing quality measurement program in which structure, process, and outcome indicator data are collected at the nursing unit level for the purpose of evaluating nursing care. Specifically, the NDNQI database includes 19 nursing sensitive quality measures that provide participating organizations with actionable insights based on structure, process, and outcome data using Donabedian's model. These indicators are evidence-informed and demonstrated to be valid and reliable related to the outcomes associated with nursing care and the profession's contribution to broader patient, financial, organization, and system level outcomes. Nursing sensitive indicators reflect the structure, process, and patient outcomes of nursing care. Structure refers to supply of nursing staff, skill level of staff, and education of staff. Process refers to assessment, intervention, and job satisfaction. Outcomes, patient outcomes will improve if there is a greater quantity and quality of nursing care. Merkel et al. 2018 also states that nursing sensitive indicators are often reported on scorecards that enable nurse leaders to evaluate their progress in achieving their strategic goals and operational and quality target. Today I will be discussing the nursing quality indicator patient falls. A fall is defined as an unpleasant descent to the floor with or without injury to the patient and occurs on an eligible reporting nursing unit. Gerard et al. 2016 indicated that falls are common adverse events experienced by patients in hospitals and continue to pose challenges to healthcare quality. Fall reduction is identified as a patient safety priority in the United States. Approximately 30% of falls result in injury, particularly among older adults. Injuries from falls burdens hospitals and patients with increased costs due to longer lengths of stay and additional patient care costs. Kanjani 2018 also states that patient falls and falls with injury are two of the 4 nurse-sensitive indicators of quality in acute care identified by the National Quality Forum and the Joint Commission. Reducing risk of harm resulting from fall has been one of the national safety goals recommended by the Joint Commission. Falls with injury, for example, fracture, dislocation, and intracranial injury, has been added to the Centers for Medicare and Medicaid Services list of hospital-acquired conditions. Nurse managers are often held accountable for the quality and quantity of nursing care on their units. Data from multiple sources are needed to identify causes for falling on their units and help nurse leaders to intervene appropriately to improve patient care quality outcomes. New nurses needs to be familiar with this quality indicator because falls can result in serious injuries to patients or even death. New nurses needs to adhere to fall prevention protocols and consider the target population. According to Kanjani, 2018, substantial cost is associated with falls, including the cost of patient care associated with increased length of stay and liability. Beginning October 2008, the Centers for Medicare and Medicaid Services eliminated payment to hospitals for costs incurred in the treatment of injuries resulting from falls during hospitalization, citing that these incidents as preventable and further compounding the fall-related costs to hospitals. My organization extracts data from the existing electronic health record system into a report to support quality improvement activities related to fall prevention. It is an upgraded system and data comes from many sources, including the patient admission, transfer, and discharge fields, fall risk assessment screens, devices used for fall prevention, the care plan, the education form, and the post-fall assessment tool documentation. Data are entered into the electronic health record by caregivers during routine patient care following the protocol for documentation. These data are extracted and used to populate individual and aggregate data into the report. A protocol for team coordination in gathering care and events results, verifying data accuracy, analyzing causes and trends, communicating feedback to individuals and groups of caregivers, and tracking the impact of improvement effort to reflect patient satisfaction with their care. The fall event data will populate into the report as soon as the form and fields from the electronic health record is signed, more like in real time. Reports can be viewed, saved, or printed for individual nurse leader use. Details in the report will be used to follow up regarding issues identified for individual patient fall events. Details in the report can be analyzed for trends in aggregate patient data or used for quality improvement processes to enhance patient safety outcomes. Reports can be printed and shared at the unit level. It is important to enter accurate nursing intervention data in the electronic health record system to conduct fall prevention quality improvement activities in your department. Identify individual issues and trends, set measurable goals, identify successful nursing practice, and compare your department's specific data to benchmark data. My organization continues to invest in automated infrastructure to enhance the use of NDNQI indicators to monitor and guide quality improvement measures at the corporate and local level. Thank you.